بدین شادم که غم از بهار
Almost 30 years ago, the fourth Khalifa, Hazrat Mirza Tahir Ahmed, may Allah have mercy on him, had a vision of a charity which would use funds wisely, attract noble souls from all parts of society, have a global reach, and attend to the needy, irrespective of race, religion, gender, or social status. Humanity First emerged from this seed. Humanity First is now registered in 60 countries on 6 continents. Over the last 26 years, Humanity First has evolved from a charity with an inspirational vision and good intentions to an organization that regularly engages with the United Nations and other international NGOs. His Holiness Hazrat Mirza Masroor Ahmed, may Allah strengthen his hand, continues to guide our teams to serve with the true spirit of dedication inspired by Islam. Let's look at the journey across each of the services that we provide. Disaster relief. In the mid-1990s, Humanity First teams in the United Kingdom and Germany sent convoys of food and clothing to the Balkans region of Europe. Over the years, we established a model for disaster relief and trained our global teams to work to a consistently high standard. Now, we can respond to concurrent disasters on different continents, collaborating with other NGOs through the United Nations. Our emergency medical teams are being accredited with the UN to be one of the select NGOs allowed to be a first responder. In the last 2 years, our COVID response in 78 countries has reached over 1 million people. Global health. In the early years, medical volunteers would spend their time serving in emergencies or ad hoc medical camps to extend access to care to rural communities. Now Humanity First runs skills transfer sessions to increase local clinical capacity. Humanity First has established 9 hospitals and clinics, with others in the process of being established. Staff are recruited and trained to offer high quality care at minimal cost. In the last year, Humanity First surgeons have even started performing transplant procedures. Food security. Humanity First's original efforts around food security included the provision of food rations for vulnerable families. We still continue with those efforts today. However, now we enable entire clusters of villages to cultivate and sell crops for themselves. We provide them with seeds, tools, fencing, and access to irrigation. We provide innovative solutions and training to maximize crop yields, minimize waste, and enable villagers to process crops to sell or use high-value products. Even in higher income regions, poverty is on the rise. Every month, thousands of families use our food banks and pantries in Europe, Australasia, and North America as a lifeline. Our Water for Life program. Humanity First has been investing in infrastructure, working with the IAAE to provide longer-term solutions. Our local engineers have been trained and have repaired thousands of water hand pumps across Africa, saving long and painful journeys to access drinking water. In South Asia, more than 1,000 wells have been built and over 800 hand pumps have been established. More recently, Humanity First has been investing in solar boreholes which require no pumping and minimal maintenance and provide water on tap to multiple villages. Knowledge for Life program. From initially providing ad hoc supplies for poorer students, Humanity First has now built 67 schools to extend access to education to rural children. Our Masroor Senior Secondary School in the Gambia has the largest assembly hall in the country with a capacity of over 2,000 students. Our vocational training centres offer qualifications in information technology, tailoring, languages and technical skills through which over 60,000 graduates have gone on to gain employment and sometimes even establish their own businesses. Turning next to our Gift of Sight program. Some estimates suggest that over 235 million people live with moderate to severe visual impairment. Humanity First began by offering free cataract surgery in Africa. This expanded to over 15 countries across Africa, Asia, and Central America. Today, Humanity First runs mobile eye surgery units in Burkina Faso, Benin, and Togo, and a new unit is about to be deployed in Uganda. Community Care Program. A care home for the elderly has been established in Sao Tome, and our teams are out on the streets most weekends in European cities. Orphan Care Program. We have developed more comprehensive and longer-term support for orphans, including those impacted by the Ebola crisis in Sierra Leone, Liberia, and Guinea. Today, Humanity First runs an orphanage in Benin, with another under construction in Uganda, and supports hundreds of orphans elsewhere with food, education, and healthcare. From its roots in the UK in the mid-1990s, when Humanity First was focused on ad hoc assistance for disaster victims, Humanity First has now evolved to building longer-term infrastructure to people in need. Now, we look at the sustainable impact of projects, and therefore our attention is on local training and capacity building, and the provision of resources to enable communities to get themselves out of poverty. Millions of people are being reached every year through the work of Humanity First. But this is a journey, and Humanity First will, inshallah, continue to grow, attract more noble souls to assist us, and reach millions more people around the world.